So let's see. This is eBay's Dave DeBronkart and the famous
Leslie Kernisan, Geriatrics blog.
And we are at the Medicine X conference in Palo Alto on late September 29th, 2013. And we have this sort of convening of our visions that we wanted to capture briefly on video. So what are you basically about? Your work is about?
Well, I'm a geriatrician and general internist with a long-standing interest in improving the care of older people through empowering older patients and especially their caregivers. I have a background in quality, and I had started off researching quality measures and thinking what kind of quality measures could lead to better care for older people.
Talk to the camera.
And then I discovered a website for caregivers of older adults, for boomers, worrying about aging parents, and I thought, oh my God, we could teach geriatrics to caregivers. We could teach them what to look for, and we could help them learn what to do, and we could help them learn to recognize better geriatric care or to ask for better geriatric care, and that could be more powerful and faster than trying to develop the right measures and try to get doctors to change what they're doing. I mean, we want doctors to change what they're doing, but are we going to do it through our measures and our internal pressures, or could we do it by educating and activating caregivers? And because, for instance, I feel like we can tell doctors to be careful about prescribing medications that might cause confusion or poor balance, and we could also teach caregivers to ask when a medication is prescribed to an older person, could this medication affect my mother's thinking or balance? Or there's a list of these medications that are risky, and most caregivers don't know that it exists, and it's in the public domain on the website for Health and Aging, the American Geriatric Society.
And what thrills me about this is that this is completely aligned with our work in the Society for Participatory Medicine of patients becoming competent, active partners with their physicians. Clinicians are commonly overworked and overloaded with all kinds of things. So certainly I'm no surgeon, but there are a lot of things I can understand, so I can do whatever part of the work that I'm capable of.
Yes.
So what's the status of this work in your view? Is this a new idea, or do you have some website going where this work's starting?
Yeah. Well, so for many years, I wrote about geriatrics for family caregivers on a website called caring.com. And I started in 2008, and I was excited about this, but I went to the Division of Geriatrics at UCSF where I was a fellow, and when I said we could teach geriatrics to caregivers, they said, oh, well, that's interesting, but right now most of our funding is for teaching geriatrics to other medical trainees. And I think they were also not quite sure about partnering with a commercial website, whereas what I liked about the website is that they could change and update things, and that they clearly had expertise in dissemination, in reaching people, and in making the information visually appealing. So I was interested in that partnership, and I ended up working, collaborating with them on my own, and I created a lot of content there, and it was useful as an experience. And now, in the last year, I've discovered the participatory medicine movement, and which felt right up my alley. And so I've phased out my work with the other website, but I'm really interested in, one, how technologies can help, again, support this engaged, empowered, activated caregiver, and two, in how we might adapt the methods of the e-patient movement for people who have multiple chronic illnesses and maybe a caregiver involved.
Good. So where should people go if they want to get involved in this? Because right now we don't have a project in the Society for Participatory Medicine that focuses on geriatrics. Should they go to caring.com, or do you have another website or Facebook page or anything?
Yeah, so they can look at some of the things that I wrote for caring.com. I'm not working with them so closely anymore because they're not spending money on creating content.
Okay.
But what they can do is, one, they can join the Society for Participatory Medicine and connect with me, because I'm looking for caregivers of elders or people who are interested in helping me figure out what are the right tools to give caregivers. Two, I do have a website, drkernisan.net. drkernisan.net, where I now have my own blog with advice and tips for caregivers,
well, good.
that's where I'm starting, and I wanna work on an ebook for caregivers and connect with more people, and then I do blog about technology for geriatrics, but that's more for the sort of developers and people in healthcare.
Well, good. We certainly know that demographically, time is on our side. There's
absolutely.
a whole lot of people who are headed this way, so that's great. Let's get something started. Thanks for your time.
Thank you, Dave.